What is ALS? ALS is a disease that causes motor neurons, the nerve cells that send messages from your brain to your spinal cord and then to your muscles, to break down and die. These motor neurons control all your voluntary movements, allowing you to do things like walk, chew and swallow food, and even breathe. There are two main types of these nerve cells. Upper motor neurons are located in the brain. They send signals down the spinal cord to the lower motor neurons, which tell the muscles to move. With ALS, your brain can't send messages to your muscles anymore. Because the muscles don't get any signals, they become very weak and waste away. This is called atrophy. ALS is a progressive disease, which means it gets worse over time. As your muscles atrophy, it gets harder for you to walk, talk, eat, and breathe. With ALS, your brain can't send messages to your muscles anymore. This causes your muscles to become very weak and waste away, making it harder for you to walk, talk, eat, and breathe. Medication and other therapies can make daily life better and more comfortable, but there's no way to reverse damage caused by ALS. Types of ALS. There are two types of ALS. Sporadic ALS is the most common form. It affects up to 95% of people with the disease. Sporadic means it happens sometimes without a clear cause. Familial ALS runs in families. About 5% to 10% of people with amyotrophic lateral sclerosis have this type. Changes to a gene cause FALS. Parents pass the faulty gene to their children. If one parent has the gene for ALS, each of their children will have a 50% chance of getting the gene and having the disease. What causes ALS? Researchers still don't know exactly what causes amyotrophic lateral sclerosis. Gene changes, or mutations, are behind 5% to 10% of cases. Researchers have linked more than 12 mutations to the disease. One mutation is to a gene that makes a protein called SOD1. This protein may be toxic to motor neurons. Other gene changes in ALS might also damage motor neurons. The environment could also play a role in ALS. Scientists are studying whether people who come into contact with certain chemicals or germs are more likely to get the disease. Scientists are also looking at these other possible causes. Glutamate. This chemical is a type of neurotransmitter. It sends signals to and from the brain and nerves. With amyotrophic lateral sclerosis, glutamate builds up in the spaces around nerve cells and may damage them. The medication riluzole works by lowering glutamate levels and can help make the disease progress more slowly. Immune system problems. Your immune system protects your body from foreign invaders such as bacteria and viruses. Microglia are the main type of immune cell in your brain. They destroy germs and damaged cells. With ALS, microglia might also destroy healthy motor neurons. Mitochondria problems. Mitochondria are the parts of your cells where energy is made. A problem with them might lead to amyotrophic lateral sclerosis or make an existing case worse. Oxidative stress. Your cells use oxygen to make energy. Your body may form some of this oxygen into toxic substances called free radicals, which can damage cells. The medication edaravone is an antioxidant that can help control these free radicals. ALS symptoms. Amyotrophic lateral sclerosis affects everyone differently, but it causes a gradual loss of control in your voluntary muscles, the ones you use to walk, talk, move, speak, eat, drink, and breathe. Early symptoms of ALS. Early symptoms of amyotrophic lateral sclerosis may include muscle twitching in the arm, leg, shoulder, or tongue. Muscle cramps, especially in your hands and feet. Muscle tightness or stiffness. Weakness in your hands, arm, leg, or only one side of the body. Trouble speaking loudly, slurred speech, problems chewing or swallowing. Symptoms of ALS progression. Later on, amyotrophic lateral sclerosis can cause you to trip or fall more often, drop things a lot, lose weight, drool or choke on liquid, feel tired all the time, have trouble controlling facial expressions, laugh or cry without meaning to. As the disease progresses, it affects more of your body. Eventually, you may not be able to control your muscles and do things like these on your own. Move your arms and legs. Stand or walk. Get in and out of bed. Chew or swallow. Talk or form words. Breathe without help from a machine. Less commonly, you may notice changes in your memory or how you think and act. ALS diagnosis. Your doctor will give you a physical exam and ask about your medical history. You'll also get a neurologic exam to check how well your muscles and nerves work together. These tests measure your reflexes and check for muscle problems like weakness, wasting, or spasticity. Symptoms of ALS can mimic other medical problems. You'll likely need several tests to rule out other health conditions and confirm an ALS diagnosis. The most common ones are electromyogram. Your doctor will place a needle through your skin into your muscle to measure electrical activity. If you have ALS, your muscle fibers won't fire as they should. Nerve conduction study. This test checks for communication problems between your nerves and muscles. Magnetic resonance imaging. Your doctor will take detailed images of your brain and spinal cord to check for tumors or other things that might cause your symptoms. Blood and urine tests. These can help your doctor rule out other health conditions. Spinal tap. This is also called a lumbar puncture. Your doctor may put a hollow needle in your lower back to take a sample of your spinal fluid. Muscle biopsy. Your doctor may remove a small part of your muscle so they can look at it under a microscope. They'll give you numbing medicine first, so it doesn't hurt. You may be more likely to get this test if there's a chance you have another muscle disease besides ALS. ALS versus MS. Amyotrophic lateral sclerosis and multiple sclerosis both affect the nervous system. They have many symptoms in common, including weakness and trouble walking. But these two conditions are different. MS is an autoimmune disease. The immune system attacks and damages myelin, the protective coating surrounding neurons in the brain and spinal cord. Often symptoms come and go during periods called relapses and remissions. MS usually starts between ages 20 and 40, and people can live for 30 years or more with the disease. ALS causes motor neurons to die. It is a progressive disease, which means that it gets worse over time. Amyotrophic lateral sclerosis most often starts between the ages of 40 to 70, and people usually survive for 2 to 5 years after their diagnosis. My ALS Story. By Fred Shank, as told to Kara Mayer Robinson. I was diagnosed with ALS last year. The symptom that brought me to a doctor was a drop left foot. But looking back, there were other signs. The earliest sign was struggling to keep flip-flops on my feet when I walked on a boardwalk after years of wearing them. I remember my toes couldn't grasp the soles easily and they'd slide or slip off. Later, even though I was very active and in good shape, I work out regularly, I play tennis twice a week, and I'm a Peloton enthusiast, I remember not being able to fire up my legs and accelerate to reach a jump shot in tennis. At the time I chalked it up to getting older or being tired. When I noticed the drop foot, I went to a sports medicine doctor, who suggested an MRI and X-rays. His initial concern was a herniated disc in my back, which we found by doing an EMG on my left leg. It showed the disc was disrupting my nerves. He recommended spinal surgery, either full fusion or microfusion. But as I was deciding which one to have, my right leg started to show symptoms. We thought the herniated disc was now affecting both legs, so we went with full fusion spinal surgery. 2 months later, I wasn't bouncing back stronger and my nerves weren't improving. I went to a neurologist, who recommended another EMG. I remember watching her face when she did the test on my legs and lower back. Things were off. She needed to do more tests on my upper body and neck and asked me to come back at her next available time, which was nearly a month later. She also diagnosed motor neuron disease with the possibility of ALS. She had me take the genetic test for ALS and told me about her hospital network's ALS clinic. I decided to get a second opinion at the ALS clinic at Johns Hopkins. They got copies of my test, ran a full blood screen, and did a clinical exam. They said it was probable I had ALS and recommended starting treatment immediately. ALS apparently needs months to officially be diagnosed, but they didn't see a reason to wait, so I went with the Johns Hopkins team. Doctors have to rule out nearly every other thing to arrive at ALS. There's a genetic test, but it only identifies about 10% of the cases. It's a long road, not only because how the disease works but because of our healthcare system. There aren't neurologists on every street corner who have experience with MND or ALS. Finding someone with that insight and getting an appointment takes time, which can be terribly frustrating. If you're on this road, my advice is to be kind to yourself. It's a lot to deal with. No emotion is wrong. Questions for your doctor. There's a lot to know about ALS, and it may take more than one appointment for you to absorb all the information. Write down the topics you'd like to go over and bring the list with you. It's easy to forget things when face to face with your medical team. Here are some questions to get you started. What are the symptoms of ALS? What kind of ALS do I have? How do you know my symptoms are from ALS? Can you go over all my test results with me? What are all my treatment options? How can occupational, speech, and respiratory therapy help? Is there a cure for ALS? Does ALS cause pain? You may also want to ask, can I catch germs and get sick easier? Does ALS increase my chances of other health problems? What kind of exercise is best for someone with ALS? Do I need to change my diet? How fast will I lose muscle strength? Is there anything I can do to slow the progression of ALS? When should I get home health care services? How can I join a clinical trial? When it comes to financial support, ask your doctor if you can talk to a social worker or navigator for advice. Some questions to ask are, how can I get help paying for my medical care? What does insurance cover? How can I apply for Medicare or Medicaid? How do I apply for disability or Social Security benefits? Do veterans get extra benefits? If so, how do I find out what they are and how to get them? ALS treatment. Medication and other therapies can make daily life better and more comfortable, but there's no way to reverse damage caused by ALS or to cure the disease. You'll need to work with a team of health professionals to get the most benefit out of the available treatment options. Treatment for ALS may include medication. These are prescription drugs that may help you live longer or improve your quality of life. Medications approved to treat ALS include riluzole. You take this drug by mouth, either as a liquid or a tablet that dissolves under your tongue. It may help you live 3 to 6 months longer. Edaravone. You get this drug through a vein in your arm or as a pill. It may help you function a little better day to day, but scientists don't know if it can help you live longer. Previously, sodium phenylbutyrate and torsodiol was a treatment for ALS. However, it's no longer available in the US after clinical trials showed the medication wasn't more effective in slowing how quickly ALS progresses compared to a placebo. Drugs to ease symptoms. Your doctor may also give you medicine to manage problems related to ALS, including muscle cramps or spasms, constipation, fatigue, making extra spit or mucus, pain, depression, trouble sleeping. You can also take medicine to manage pseudobulbar affect. PBA is the medical name for sudden episodes of crying or laughing that happen at the wrong time. Your doctor can let you know if PBA treatment is right for you. Your ALS care team. Along with a regular doctor, you may see a neurologist to prescribe ALS treatment, a dietitian to help you get good nutrition with easy-to-swallow foods or through a feeding tube, an occupational therapist to teach you about techniques and tools to stay independent, a physical therapist to help ease pain and keep you moving for as long as possible, a speech therapist to help you speak louder or use devices to communicate, a respiratory therapist who will check your breathing and provide respiratory care, a psychologist or counselor to get ongoing emotional and mental health support, a social worker to help with practical needs like how to pay for things or deal with insurance, a hospice nurse to help you with end-of-life care. What to expect with ALS. Amyotrophic lateral sclerosis is a progressive condition that causes you to lose control of your muscles in stages. At first, you may notice mild weakness, stiffness, muscle twitching, or slurred speech that worsens over a few weeks. You may have more trouble with fine movements, such as buttoning a shirt or turning a key. You may stumble or fall more than usual. Your symptoms may worsen gradually over months or years or level off after a period of fast progression. As the disease gets worse, you'll lose control of more vital voluntary muscles. You won't be able to move your diaphragm, the muscle in the chest that helps you breathe, or the muscles in your head, neck, and throat. Eventually, People with ALS can't control any of their voluntary muscles and become paralyzed. You should still be able to taste, touch, smell, and hear. But for a small number of people with ALS, the disease may affect memory and the ability to make sound decisions. Right now, there isn't a cure for amyotrophic lateral sclerosis. ALS is fatal for everyone who gets it. Most people die from ALS because they can't breathe without the help of a machine. This is called respiratory failure. The timeline is hard to predict. Most people live for 2 to 5 years with the condition, although around 10% of people may live up to 10 years or longer after their diagnosis. An even smaller group may live more than 30 years. If you want to know more about your own timeline, ask your doctor what symptoms to watch for and when you might need daily assistance or more help. Living with ALS. ALS can be a challenge, but you do have the ability to take control of your life. Here are some ways to support yourself. Take time to feel whatever emotions you have and adjust to your diagnosis. Learn all you can about ALS. Start on a treatment as soon as you can. Find a doctor you trust and follow their advice. Be an active partner with your medical team. Involve friends and family in your care. Come up with activities to challenge your mind. Create a routine to add structure to your day. Eat a balanced diet with plenty of fruits and vegetables. Join an ALS support group. Make plans for your future. Stay hopeful and don't let your condition define you. Ask your doctor or social worker to connect you with people who have ALS or visit the website of the ALS Association to find support groups in your area. Home accessibility. As your mobility changes, you may need to make changes to your home so that it's safe and accessible. An occupational therapist can suggest ways to modify your home. These are some home adaptations you might make. Remove or secure loose rugs and other tripping hazards. Add a ramp or platform lift if you have steps to your house. Install a stair lift to take you from one floor to another. Make doorways and hallways wide enough to fit a walker or wheelchair. Add roll-under sinks so you can fit your wheelchair underneath. Install grab bars next to the shower, tub, and toilet. Put a commode over the toilet. Change the shower to a roll-in type or add a bath transfer system. Making changes to your home can be expensive. A grant or low-interest loan can help you pay for them. If you're a veteran, you may qualify for a grant through the Veterans Administration specially. Adaptive Housing Program. Your state may have an Assistive Technology Initiative program to help you cover the costs. Daily tips. Amyotrophic lateral sclerosis will add many challenges to your daily life. Here are some ways to make your everyday activities more manageable. Buy rubber grip forks, spoons, knives, brushes, and combs or wrap the handles of these tools with foam or rubber to make them easier to hold. Use a large-handled mug and cups with ribbed surfaces. Place items that you use a lot, such as plates and glasses, on low shelves you can reach. Put a chair in the kitchen and bathroom so you can sit while cooking and getting ready. Squeeze toothpaste into your mouth instead of trying to squeeze it onto the toothbrush head. Buy products with flip-top lids instead of twist-off ones. Change buttons to Velcro and attach a metal ring to zippers. Or buy clothes that have elastic waistbands instead of buttons and zippers. Do only a few necessary tasks each day, and take breaks between them to rest up. Tips for leisure activities. You don't have to give up all the things you love to do because of ALS. Modify your activities to make them easier. If you like to boat or fish, build a ramp to help you get down to the dock. Buy an automatic caster to make fishing easier. To take photos, mount a camera on your wheelchair. If you like to read, use a book stand or listen to audiobooks. And if you play sports, ask your local ALS organization to recommend any adaptive programs in your area. You may have to change some of the activities you can no longer do. Instead of hiking, walk in the backyard or take your wheelchair for a ride through the neighborhood. Travel the world through photos and video blogs that people post online. Have friends bring you dinner or use a delivery service when you can't get out. Caring for your emotional and mental health. There's no right way to react to ALS, and it's natural to go through a range of emotions after your diagnosis. You may feel angry, sad, or scared. Many people feel anticipatory grief, a strong sense of grief about future losses. Strong feelings like shock may ease over time, while other feelings, including death anxiety, may grow stronger. These mood symptoms can affect you just as much as physical problems. The good news is there are ways to boost your well-being no matter what you're going through. Your emotional and mental health support team may include a mix of people, including friends and family. Others with ALS, psychologists or psychiatrists, social workers, spiritual and grief counselors. Most people with ALS don't get anxiety or depressive disorders. But you should check in with your doctor if you have trouble managing your moods or can't control negative thoughts and worries. Mental health treatment, including behavioral therapy, can help teach you skills to adapt to life with ALS. ALS support. If you or a loved one is diagnosed with ALS, you may go through a range of emotions. Remember, there's no right way to feel about this disease. Give yourself time to let the news settle in. Once you're ready to learn more, ask your doctor or social worker how to find resources in your area. Let them know if you're looking for practical help or emotional support. Informational websites and social groups can help you connect with other people who have amyotrophic lateral sclerosis. You can start by searching online for ALS support groups near me to see what pops up. You'll also find more info about how to find in-person or virtual support groups through I Am ALS, ALS Association, ALS Facebook groups, ALS caregiver support. Like your loved one with ALS, you're not in this alone. Reach out to friends, family, or neighbors when you need support. Most people are happy to help, they just don't know how. Be specific about your emotional or practical needs. Ask the doctor or social worker how you can get respite care. This is a type of relief offered to caregivers. During respite care, someone will stay with your loved one while you take a break for a few hours or a few days. You can run errands, rest in another part of your house, or take a short vacation. The ALS Association's Care Connection program can also match you with volunteers in your area who can tackle some of your everyday tasks. For example, you can ask for help with meals, rides to medical visits, or childcare. You can also reach out to other caregivers who know what you're going through. Caregivers who confide in each other often report less stress and other problems. Visit the ALS Association website to find an ALS support group in your area. It's important to ask for help when you need it because caregivers for people with ALS face higher odds of burnout. This is a type of physical, emotional, or mental tiredness caused by ongoing stress. Your chances of anxiety or depression also go up if your loved one needs constant care, but there are ways to strengthen your well-being. Here are some ways to practice self-care. Make sleep, healthy eating, and exercise a daily priority. Carve out some me time each day. Read a book, see a movie, or do something else you enjoy. Meet a friend or another caregiver for a supportive talk. Know when to say no. You'll also want to learn stress management skills. Here are some techniques that may help you feel calm. Deep breathing exercises, yoga, tai chi, progressive muscle relaxation, meditation. Talk to a professional counselor or therapist if you're unsure how to manage stress or mood problems. Let them know if you have symptoms like pain, hopelessness, anger, trouble sleeping, or fatigue that don't go away. These could be signs you need professional mental health treatment to feel better. Takeaways. Amyotrophic lateral sclerosis damages nerve cells that help your brain tell your muscles to move. As ALS progresses, it becomes harder to walk and do everyday tasks. After a diagnosis, it helps to learn all you can about your condition. Ask your medical team and an occupational therapist what home modifications and other changes can make your daily life easier. ALS FAQs. What is the life expectancy of a person with amyotrophic lateral sclerosis? The average survival time with ALS is 2 to 5 years, but it differs for each person. Some people can live for 10 years or more. What are the 7 stages of ALS? Amyotrophic lateral sclerosis progresses differently for each person. To help people understand the progression, some doctors divide ALS into these 7 stages. Early stage ALS. Symptoms like weakness or trouble speaking start before you get a diagnosis. Diagnosis stage. This is when doctors rule out other conditions with similar symptoms and confirm that a person has ALS, middle stage ALS. Symptoms like weakness, stiffness, and swallowing get worse. Middle stage ALS, the second region. Muscles that control breathing weaken, and people may need a ventilator or other support to breathe. Middle stage ALS, the third region. Muscles of the trunk and belly weaken, making it harder to stay balanced, sit up, and walk. Mandatory gastrostomy stage ALS. At this point, the person with amyotrophic lateral sclerosis may need a feeding tube because it's too hard to swallow. Late stage ALS. Most voluntary muscles are paralyzed at this point. People are very limited in their ability to move, eat, and breathe. What is the longest someone lived with ALS? The physicist Stephen Hawking, Ph.D., may have lived the longest with ALS. Doctors diagnosed him when he was 21. Hawking died in 2018 at age 76, after living for 55 years with the disease. What is the leading cause of death in people with ALS? Breathing failure is the most common cause of death in people with amyotrophic lateral sclerosis. It happens when the muscles that control breathing become too weak to work. Is there a cure for ALS? Right now, there's no way to reverse damage to motor neurons or cure the disease. But there are treatments to slow ALS and prolong survival.